Welcome to Ministry in Motion, where we explore best practices for your ministry in the 21st century. Whether you're a pastor or a lay leader in your local church, God wants you to be a great Christian leader. And our topic today, so relevant: depression recovery. Maybe you're dealing with depression, or you want to know how to minister to people dealing with depression in your community. Our guest, Dr. Neil Nedley. Neil, it's great to have you with us today.
Well, thank you.
And
it's
I have been so blessed because my wife is really involved in ministry to people. She loves the books you've written. And just share with us your journey and how you became so interested in depression recovery.
Well, I became interested in it because so many of my patients had depression and anxiety. And whenever I see something very common in patient after patient, I realize as a physician, I need to become an expert in that area.
So there was a very clear need. Now I hear, obviously I'm not medically trained, but I hear about depression as being like an epidemic. Is it really that bad?
It is. It's actually increasing throughout the world. In fact, one of the most prestigious journals in the world, called Nature magazine, had an entire issue on depression, and they mentioned that there's not a single country in the world that's not affected by it. Some more so than others, but about 400 million people have depression, major depression worldwide.
So you became interested because you saw it occurring over and over again as patients came for help.
Exactly. And I realized that, I can't just do a patch job if I'm seeing them on a regular basis. I need to become an expert in the field. And so that's when I went on my quest to become someone very knowledgeable on the field.
And God is blessed in amazing ways, and we'll come to that a little later in the program. Let's talk about definitions. How would you define depression?
Well, depression actually means you have 5 of 9 symptoms. It doesn't mean just sadness. A lot of people think, oh, I don't have depression because I'm not sad. That's only one symptom. Another symptom is apathy. This is where you wake up in the morning and you're not excited about the day.
Don't want to get up.
That's right. And so that's a symptom. And you have to have these symptoms majority of time for 2 weeks. A third one is lack of concentration, where you're reading something, you get to the bottom of the page, and you know that you didn't remember what was at the top of the page, and so you have to go down it again. And so you can also almost be in a brain fog. Sleep disturbances, whether it's wanting to sleep all the time or waking up too early and not being able to go back to sleep or having insomnia, weight or appetite changes, fatigue, loss of energy, morbid thoughts. These symptoms, you don't have to have all of them, just 5 of 9 symptoms. And if you have those symptoms, you have major depression and you're at risk for a whole lot of problems.
I'm imagining someone watching going, oh no, as they're checking, as you're mentioning each one. If we don't know we're depressed, we just keep dragging on, not knowing what's wrong?
That's right. A lot of people just think that this is normal for that phase of existence.
Okay.
It's not normal to be depressed.
Okay.
And it should be considered as something that is outside the realms of normality so that the individual can get the therapy that they need to get over it, because depression should only be a transient problem. It should never be a permanent problem.
Now, I remember I was reading a Bible text where Solomon says anxiety within the heart of man causes depression, but a good heart or glad heart, good heart makes it glad or something. Is anxiety, that's different from depression, right?
It is, but there's a lot of overlap.
Okay.
About 80% of people with depression have anxiety.
Okay.
And probably 2/3 of the people with anxiety have depression. And so there is some overlap there, but anxiety is where you are feeling on edge. And you just have this sense of maybe even dread or impending doom. That would be anxiety. But there are other forms of it. There's obsessive compulsive disorder, which is an anxiety disorder. Post-traumatic stress disorder, where you have movies of trauma being played back. That's an anxiety disorder. Panic disorder. Social phobias. Anyone that has a phobia has actually an anxiety disorder. So anxiety, actually, if we take a look at all the anxiety disorders, it's even more common than depression.
So we're going to talk about treatment plans a little later, but how many people are taking medication to try to feel better?
Scores of individuals. It's now the #1 classified category of drugs dispensed in the Western world are dealing with depression and anxiety. And so these drugs are flying off the shelves, but as Nature magazine mentioned, these drugs have their limitations. They're not a cure-all. And they might cover the symptoms, but sometimes they even prevent us from discovering more of the reasons for it to be able to get a cure, because they're more of the patch job than they are actually dealing with the root causes. And if we deal with the root causes, then we can talk about the cure word.
Let's talk about we've talked about some symptoms.
Yes.
And you listed, I think, 9 of them, right?
Yes.
And all of these are in your book, Depression, The Way Out.
Correct.
Right?
Yes. Yeah.
So we check, we go, oh, I think I've got 4 of 9.
Yeah, you can also take a free test on our website
Okay.
To find out whether you have it and how severe it is. And so it's a very simple test. You can go through quick 9 or 10 questions and you'll have the answer.
All right. Later in the program, what's the web address? And we'll put it up later in the
That's
program.
drnedley.com.
drnedley.com. Okay, we'll put that up a little later. So people could actually go take the test.
Yeah, and find out whether they have it.
Oh, I've got 2 things I'm dealing with right now, but overall I'm doing well, or red light starts
That's right.
flashing. After the break, we're going to talk about some causes of depression, and what you call in your book hits.
That's right.
I didn't know what that was at first, but
Yeah.
recognizing some things that can cause depression.
Risk factors.
Risk factors would be another way.
Yeah.
Perhaps you're watching the program and you're going, I have a loved one who is really depressed. I don't know how to diagnose that, but if you're talking about the symptoms, my loved one, my church co-leader is depressed. What can we do to help? We're going to talk about causes of depression, and then the way out, some strategies that can help us to experience life in all of its fullness. We're talking about depression recovery with Dr. Neil Nedley. We'll be right back with more Ministry in Motion right after the break. Welcome back to Ministry in Motion. Our topic today, depression recovery, and our guest, Dr. Neil Nedley. Neil, before we go on to talk about causes, does it affect people of every age, men and women? Is it any respecter of persons?
It's no respecter of persons. It can affect every profession. It can affect every age. It is a little more common in females versus males if we're just taking a look at depression. But suicide is more common in males than in females.
And what about age? Can children be depressed too? Or
they can, yes. In fact, many of the people that we see, when I ask them, how long has this been going on? They'll say, from the time of my earliest memories, I think I've had depression.
Wow.
So it can happen in childhood.
In your book and in the Depression Recovery Program, you talk about hits or risk factors. I'm assuming we all take some hits or have some risk factors. Is that right?
Well, yes.
That's part of
just about everybody
life.
can, yes. But fortunately, the brain is pretty resilient.
Okay.
So we can undergo 4 different categories of risk factors or 3 and still not have depression. But once we get 4, 5, 6, any brain is susceptible to depression. There are a lot of people thinking, hey, I'm never going to suffer from this. I've never had it. You get enough hits, you're going to get it.
And that was me, I don't know how many years ago now, more than 20 years ago, and I just moved, and there were a lot of other changes, and then I broke out in lesions on my body, and I didn't know they were taking biopsies, and my wife said, you're depressed. I said, I don't get depressed. And she gave me the symptoms, and I said, I'm depressed.
Yes, that's right.
So talk to me, I think you have in your book 10
Yes,
hits
there's 10 categories of risk factors. There's actually over 100 causes of depression, but we've categorized them into 10 different categories.
Okay.
And of course, the one that everyone knows about is genetics. If your mom or dad were depressed, they're more likely that you're going to have it. But that's never enough to cause depression in and of itself. So you might have every bad gene known to mankind, and you still won't have depression unless you have other hits.
Okay, so don't give up if you've got a parent who's depressed or
That's right.
a brother who's depressed.
Exactly. The
Okay?
second one is developmental. That has to do with how we were raised. If we were raised with a history of trauma and abuse and a dysfunctional family, that can play a role in regards to our brain. So that's a second hit category. But again, you need about 4 before you're going to get depression. So.
And that's something that I really am not able to do anything about if I grew up in a
That's
unhealthy
right.
environment.
You're
right?
going to have that developmental hit go with you, but it doesn't have to affect you if you take care of the other hits that you can take care of.
All right, let's go on to the third.
So the third one are lifestyle hits. This has to do with whether you're on a regular exercise program, whether you're being exposed to bright light. It turns out light through the eyes helps our brain chemistry. And whether you're being exposed to fresh enough air on a regular basis. And
now, that's something we can do something about, right?
Exactly.
And I understand in your residential depression recovery program, people do a lot of walking. They get out.
Exercise is key. Actually working the body physically helps it mentally.
That's
and
amazing.
so, exercise is a key part of improving as well as preventing depression and anxiety.
So if someone's taking a list, they can put alongside, we can do something about this, right?
Exactly.
Lifestyle issues.
Exactly.
All right?
Yeah.
Number 4?
Number 4 is circadian rhythm hits. This has to do with our regularity and our schedule. And what studies have shown is the best schedule to be on for brain chemistry is early to bed, early to rise.
Okay.
And I can change anyone who's a nighttime person into a morning time person utilizing light therapy to change their circadian rhythms.
Really?
And so anyone can take advantage and get on a more regular program, and that'll help sleep. It'll help all sorts of things in regards to brain chemistry.
Now, some people at the end may say, I need to go to the residential program that you have, or go to a locally held 8-week program, or get your book. Can they learn about this circadian rhythms in the book?
They can.
Okay.
Yes, yeah, we have it in our book and also in our workbook as well.
So if I'm not attentive to those sleep rhythms, that could be a risk factor for me as well.
Exactly. If you're having sleep problems, the first thing you need to worry about is your circadian rhythm, because if that's fixed, you're not going to need pills, you're not going to need anything else.
All right.
And so that's therapy number 1 that we give for even people that have insomnia that don't have depression.
Put a check alongside, can do something about this, right?
Exactly.
All right.
The fifth are areas of addictions. And addictions are at an all-time high in our society. One of the reasons why depression is going up. So it could be a substance addiction like alcohol, or it could be a non-substance addiction like gambling or pornography. And so addictions do play a toll in regards to brain chemistry. And that's also something that you can do something about.
Right.
And take some choice and decisions and reliance upon God to change habits. But those are things that can change.
And that's deceptive, because many people, they pursue addictions to try to feel better.
Exactly.
But it's actually causing them to
That's
slide
right.
as a greater risk.
Yeah, it's one of those
depression.
positive feedback cycles where if you have anxiety or depression, you're more likely to turn to an addiction as a way of self-medicating.
Okay.
And then that's only going to compound the problem and make it worse. And so one of the solutions is improving brain chemistry comprehensively, and getting rid of that addiction will actually help you much more.
We're taking a list. I think we're down to
That's right.
risk factor number 6.
Number 6 is nutrition. This is what we're putting
I could do
into
something
our
about
body.
that too, right?
Exactly. Sometimes just some simple changes, some more tryptophan, and the right type of tryptophan that's going to come with carbs to get it into the brain will help make serotonin. Tyrosine with carbs will also get into the brain and help with concentration and help with interest. And so there's a lot of good therapeutic techniques with nutrition. In fact, I've been gratified. I've been doing this research in nutrition for many years, Derek, but the interesting thing is last year the most prestigious journal in Europe in psychiatry came out and said that if psychiatrists and mental health professionals don't address nutrition in the brain with all the evidence that's there, it's basically malpractice because there's so much evidence that what we're putting into our body affects our brain chemistry. We know that, but yet patients aren't being told. They're given a medicine and never asked a question about what they're eating.
And you know, one of the things that I appreciate, my wife says, simple things: eat pumpkin seeds,
That's right.
put flax on your cereal,
Exactly.
blueberries, I mean, just
That's
things
right.
that can make a difference, practical.
Practical things, yeah.
After the break, we want to talk about a few more risk factors, but then we want to talk about the way out.
Great.
There are some things that we can do. You're listening and I'm listening, we're saying, taking notes. But I want to tell you what's exciting is that God wants us to experience life in all of its fullness. Some things you couldn't do anything about in your life. Some changes we can make, but we can all move towards a healthier and more joyful lifestyle. We'll be right back with more Ministry in Motion right after the break. Welcome back to Ministry in Motion. Our topic today, depression recovery. Our guest, Dr. Neil Nedley. Neil, it's been amazing to hear what some of those risk factors are. You're saying everyone could have some of those.
Correct.
But when it gets too many, red lights start to flash, high risk.
Exactly.
I think we listed 6. Can you list the last 4? And then we want to talk about what we can do.
Toxins. This is one that a lot of people are not familiar with. Of course, we heard about the Michigan lead issue.
That's right.
But heavy metals can actually, mercury is actually the most common heavy metal poisoning. And what studies have shown is the more fish you eat, the more depression and anxiety you have.
Is that amazing?
And
because people typically think eating fish is
is
healthy.
going to be healthy because the omega-3. And 100 years ago, it was a great way to get your omega-3. But not anymore because of the mercury in fish. We can track people's mercury level in their bloodstream simply by how much fish they're eating. And we did a study, in fact, if you Google us on the Scientific Forum, we did a study on the 6,000 patients that went through this program. And we asked questions about their fish consumption, and it was very clear the more fish consumed, the more depression and anxiety they had. And we're not the first ones to demonstrate that.
Wow.
And so
toxins.
we need to get rid of toxins and get our omega-3 from non-toxic sources.
Wow.
Number 8 is social. And so this might be a significant loss that you've had. It may be, the loss of a loved one. It could be loss of a job. That's right. Loss of being in a social network, having to move or something.
Makes you more susceptible to
Makes you
depression.
more susceptible. And feelings of social isolation as well.
Mm.
Number 9 are medical conditions. And a lot of those things we can do something about. High cholesterol, for instance, increases your risk of depression. High blood pressure does as well.
And those are non-communicable diseases. You don't catch those things.
That's right.
You acquire them mainly by lifestyle.
You acquire them by lifestyle as well. So there's some lifestyle things that can help correct those. And then number 10, and probably the most overlooked, is the frontal lobe of the brain approach. Our secular society, in this big push towards secularism, has actually increased depression and anxiety.
Wow.
And the frontal lobe is the seat of spirituality, morality, and the will. We now know it's the control center of the brain. And as that frontal lobe is strengthened by actually analyzing scripture and belief and applying it in your life, you actually recover from depression 70% sooner.
Amazing.
Than if
So
you're
that
not doing
spiritual
something
dimension
like that.
can help.
The spiritual dimension is key.
I imagine our viewers going, you've convinced me there are lots of risk factors. I've got more than I need, or I'm perilously close. Let's talk about the way out. What are some things specifically we could do?
Well, what I would recommend that you do is actually there's 3 major options that we offer. One is a home-based version where you can go through a program on your own, take the tests, do all those things to see what risk factors you have, and then it's a designer program in a home-based setting. It's a DVD and workbook and a packet that comes with it.
And we'll put that web address up on the screen. We'll actually turn them to our website so they can get that information.
A less expensive and actually a better option is to find a program that's being run in your community. And if there isn't a program run in your community, I would encourage you to get on our website and take the trainer course so that you can be a site to put on this program in your local community. And that actually is far less expensive for the consumer, and then they have a group setting where they're going through it with others. And so it's a very effective tool to be able to be health coached through this process. And there have now been over 20 studies published on this, and it's a humbling statement to state this, but actually it's been described as the most efficacious therapy for depression and anxiety ever published in the medical literature. And so, and you're not taking a medicine, you're not doing risky things, you're just getting on the right comprehensive program to improve brain chemistry, and it gets better. The third aspect is a residential program, and this is for the severe cases, maybe those who've contemplated suicide or have already attempted suicide, or are just beyond being able to go to a group-based program.
And there you've got a physician on site.
And that's a therapeutic program. That's not just an education program like I described earlier. This is where we have a doctor, we have a clinical psychologist, we have everything going for that individual, also in a group setting, and the results of that are also extremely powerful.
And my wife, who's a nurse practitioner, had the privilege of shadowing one of those residential programs, and she said the results were nothing short of miraculous.
Yes, it is amazing. The relatives come 10 days later and they break down in tears and saying, "What have you done with my loved one?" Of course, they look better, they're feeling better, and their balanced brain is back. They're back.
It's amazing.
And they're praising God.
So a home-based program, we can connect that through the web address we'll put on
That's
our
right.
website. A community-based program, which is typically an 8-week program,
An
right?
8-week program, once a week.
And or a residential. But there is something, you don't have to live in that debilitated state. There's a way out.
There is a way out. And take the way out. Don't put up with this, because studies show it increases your risk of disease, relationship problems, financial issues. There's all sorts of complications and all sorts of benefits if you get rid of the disease.
Someone might say, but that's going to cost some money and time. I remember in a presentation once you said that people who are depressed are less productive, they earn less money. I mean,
That's
it
right.
costs money to be depressed.
It's the best investment they can make. And 1 year later, they tell us that. They tell us how much more money they're getting in, how much more appreciated they are in the job setting. They're getting raises, or they're getting another job, and they're moving up the financial ladder, and it was the best investment they could take.
So a mixture of some very practical steps, maybe
Yes.
sometimes some medical assistance. Do they
Correct.
sometimes need medicine too? Or?
Sometimes, yeah. And so, yeah, we're not against a medicine. We just want the entire package that'll produce the best result.
And Dr. Nedley, God is producing some amazing results. And you very humbly said, best research coming out, what God's doing through this depression recovery program. Thanks for being our guest on Ministry in Motion today. And I just want to say to you, if you're watching, go to our website, ministryinmotion.tv. You can watch the program again. You say, I need to watch this, write down all of the symptoms and the risk factors, or hits as we call them. But you'll also find a web address for Dr. Nedley's program, how you can help yourself perhaps, certainly help those in your community. Depression recovery, what a gift that would be to those you love, to those in the community where you serve. Take what you've learned today, there's a need out there, and go out and make a difference, be a blessing to those around you. Thanks for joining us for Ministry in Motion.